You hear a doctor and a nurse reviewing a coma patient.
Okay, this patient has been out for some time now. We had quite difficult intracranial pressure control yesterday. We decided not to rock the boat, and you can see as a result, he had a low intracranial pressure all day. His circulation has stayed quite stable, blood pressure's good, heart rate's low. What are his pupils doing?
They're quite small.
So they're smallish, but not tiny. Is he showing any reflexive responses?
No.
Has he got a doll's eye? Let's have a look. Okay, is he coughing when you suction?
No, he isn't.
Not coughing? Okay, this indicates that at best, his recovery will probably be incomplete. The worst option is that he will remain in a coma with little responsiveness.
You hear a consultant emergency doctor talking to a patient following an accident.
Hello, Ellen.
Hi, Doc.
Can I just take a minute to talk to you about the injuries we found?
Sure.
So firstly, your neck looks fine. So in a minute, I'm going to get this brace off and you'll be able to move your neck. But you've got a fracture of your shoulder blade, a fracture of your thigh bone, a fracture through the tibia and fibula, the lower leg bones. And there are also fractures in your ankle, the talus, your heel bone, and the ankle joint above it, the calcaneus. We were quite worried about the blood flow past the fracture in your thigh. So we did an angiogram and a CT scan, and they actually show good blood flow. So with these injuries, you're going to need surgery, and it could be a bit complicated.
You hear a clinical researcher introducing a professional development workshop. Welcome to this workshop, Understanding Clinical Research Statistics. My name is Ivan Saxon, and I'm going to lead the workshop today. I'm the head of the Acute Care Surgery Unit. It's an academic unit in the Department of Surgery. This course is not the mathematics of statistics, though. I believe that a first contact with medical statistics should lead you to an intuitive understanding of the ideas behind the numbers. It should leave you with a deep sense of understanding what is meant by the numbers and techniques mentioned in the methods and results sections of published research papers. In order to critically evaluate research, you should be able to read more than just the introduction and conclusion sections of a paper. Quickly scanning for some significant p-value isn't enough. The patient population trusts you to be properly informed when you manage their health, so that's why we're here. You hear an emergency ward doctor directing her team while treating an accident victim. Okay, let's get on with the primary survey. It's a serious injury to his left leg. It's extremely pale, so blood flow could be an issue. But I'm worried about other serious injuries that aren't so obvious. A fracture of the pelvis, abdominal or spinal injuries. I think we better get the consultant emergency surgeon down here too. Okay, so you need to get the lines in, blood off, and we need to remove the rest of his clothing. We're going to want to get some x-rays done before anything else. Chest, pelvis, femur, please. And can somebody get a Doppler, please, so we can check his blood flow in the leg? You hear a doctor speaking to a woman who has presented with heart palpitations. And do you feel short of breath with the palpitations?
Yeah, and I'm losing my voice too.
So you'd just got to work and this happened?
Yeah.
When's the last time it happened?
A few months ago. I came here as well.
Okay, so I'm just going to try and massage the side of your neck here, just to see if that slows down your heart rate. Did they teach you how to try and hold your breath last time?
Yes, they did.
Did you try that this morning?
Yeah, I did.
Oh, great. Very good. Okay, well, that massage doesn't seem to be working. Let's try something else. What I want you to do now is to blow as hard as you can into this syringe. Ready? Blow, 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 blow. And stop. That doesn't seem to be doing much either. All right, we need to drop that rate, so we better try some meds. You'll need a drip. You hear an emergency paramedic talking to an accident and emergency doctor about a patient who has fallen from his motorcycle. This gentleman's name is Brian. He came off his motorbike at a corner and his leg hit a telephone box.
Oh, I see. Looks like he fell pretty hard.
Yeah, when we arrived, he was sitting up and talking. GCS 15 and no signs of head injury, just some pain in his right shoulder, but the main injury is a deformed and angulated right femur, which we've manipulated on the scene.
How's his circulation around the leg?
He had a cold avascular right foot at the time, and the blood supply seems to have come back post-manipulation. Numbers-wise, he's normal. He's had 150 milligrams of ketamine and a total of 8 milligrams of morphine as well.